you're not thinking about working abroad, you've probably heard conflicting information. Today, I'm breaking down exactly how nursing works in Germany and the United States, the real requirements, the actual salaries, and what life is truly like. I'm Ruby and I work with Flores where we specialize in healthcare career pathways. Over the past few years, I've helped hundreds of nurses navigate international opportunities, and I've learned one thing. Most people don't have accurate information. So today we're doing a deep dive into nursing in Germany versus the United States. We'll cover the actual healthcare systems in both countries, real salary ranges and what affects them, complete requirements with nothing hidden, lifestyle considerations you need to think about, and the honest pros and cons of each. Grab a notebook, this is comprehensive. Before we compare anything, let's understand why both countries are recruiting international nurses. We need to talk about the global nursing shortage, and it's very real. Let me start with Germany. Germany has an aging population with about 21% of people over 65 years old. They have fewer young people entering the nursing profession, and they are currently short approximately 200 nurses. By 2030, experts project that the shortage will reach 5,000. That's massive. Now, the US has a similar situation. They currently need over 100 nurses, and by 2030, you're looking at a shortage of 1.1 million nurses. Baby boomer nurses are retiring in large numbers, and the pandemic has increased healthcare demand significantly. Here's what this means for you. Both countries have created structured pathways specifically for international nurses. This isn't about taking advantage of you or offering you second-rate opportunities. It's about addressing a real healthcare crisis while offering you genuine career options. These are legitimate, regulated programs with real protection. Now, let's break down each country systematically. Let's start with Germany and understand the complete picture. First, you need to understand how the German healthcare system works because it directly affects your experience as a nurse. Germany operates on a universal healthcare model, which means everyone in the country has health insurance, either public or private. The standard of care is high. There's a strong emphasis on preventive medicine, and nurse-to-patient ratios are actually regulated by law. This is very different from many countries, and it affects your work environment significantly. Now let's talk about money. But I want to give you realistic numbers based on current 2025 data. If you are a newly licensed nurse just starting out, you will earn between 2,800 euros and 3,200 euros gross per month. After taxes, that's approximately 2,000 euros to 2,300 net. Once you have 3 to 5 experience, you're looking at 3,500 euros to 4,200 euros gross per month. After taxes, that's around 2,500 to 2,900 euro net. If you become a senior or specialized nurse, you could earn 4,500 to 5,500 more gross per month, which comes to about 3,000 to 3,600 net after taxes. Now, I'm showing you both gross and net salaries because this matters. German taxes are high, usually around 30 to 40% depending on your income bracket. But here's what's crucial to understand. Those taxes cover universal healthcare for you and your entire family, pension contributions for your retirement, unemployment insurance, and long-term care insurance. So while the take-home salary looks lower than in the US, your actual expenses are structured very differently. Let me talk about the work conditions now because this is where Germany really stands out. The standard working week is 38.5 to 40 hours, and this is legally protected. Your employer cannot ask you to work more without compensating you. When you do work overtime, you either get extra pay or compensatory time off. This isn't negotiable like it might be in some other countries. Vacation time in Germany is generous. The legal minimum is 24 days, but most hospitals offer 28 to 30 days. On top of that, you get public holidays which range from 9 to 13, depending on which German state you're in. That means you're looking at roughly 6 to 7 weeks off per year in total. Shifts are clearly defined. You have early shifts from 6 a.m. to 2 p.m., late shifts from 2 p.m. to 10 p.m., and night shifts from 10 p.m. to 6 a.m. Your rotation schedule is planned months in advance, so you know exactly when you're working. There are also regulations on the maximum number of consecutive night shifts you can work. Germany is implementing nurse to patient ratios across the country. It varies by department, but generally you're looking to 1 nurse to 8 to 10 patients on a general ward and 1 nurse to 2 to 3 patients in intensive care. This is miles better than what you might be dealing with right now. Now let's talk about requirements, and I'll be very specific about what you actually need. First, you need educational qualifications. That means either a bachelor's degree in nursing, which is BSc nursing, or a general nursing and midwifery diploma with at least 3 years of training. Your diploma must be equivalent to German standards, and there's a process to verify this. Second, you need German language skills at B2 level minimum. That's upper intermediate, which means you can hold complex conversations, understand medical terminology in German, and communicate effectively with patients and colleagues. Realistically, if you're studying consistently at 4 to 6 hours per week, you're looking at 8 to 12 months to go from beginner to B2 level. Third, work experience is also considered. Most employers prefer at least 2 years of experience. Though it's not always mandatory, recent experience is valued more highly. The visa and immigration pathway is straightforward. Initially, you will get either a skilled worker visa or an EU blue card. The duration is tied to your employment contract, which is usually 2 to 4 years, and it's renewable. After 4 to 5 years of continuous work, you can apply for permanent residency. You will need B1 German proficiency, and you will need to complete an integration course. If you want citizenship, you can apply after 8 years, though this can be reduced to 6 to 7 years if you have good German language skills. You will need to pass a citizenship test. The good news is that German now allows dual citizenship, so you can keep your origin passport. Let me talk about lifestyle now, because salary means nothing without context. If you're a single person living in Germany, here's what your monthly expenses might look like. Rent for 1-bedroom apartment ranges from 600 to 1,200 euro, depending on the city. Berlin and Munich are expensive. Smaller cities are much cheaper. Groceries will cost you 200 to 300 euros. Public transport pass costs 50 to 100 euros. Health insurance is covered by your employer, so your total monthly expenses are roughly 850 to 1,600 euros. If you're earning 2,500 euros net, that leaves you with 900 to 1,650 euros for saving. That's actually quite comfortable. Let me be completely honest about the pros and cons. The pros are significant. You get excellent work-life balance. That's actually protected by law. You have strong labor protection, comprehensive social benefits, and quality public services, including transport, healthcare. Germany is a gateway to European travel since you can visit dozens of countries easily. It's a safe, clean, organized environment with family-friendly policies. But there are real cons too. 1. The language barrier is real and ongoing. Even after you learn German, you will still face moments of frustration. The bureaucracy can be incredibly frustrating. Germans love paperwork a lot. Cultural adjustment takes real time and emotional energy. The weather may be challenging if you're used to warmth and sunshine. Social integration requires consistent effort. Career advancement is slower than in the US, and salary tends to plateau earlier than they would in America. Now let's examine the US with the same level of detail. First, you need to understand the American healthcare system because it's fundamentally different from Germany's. The US operates on a private healthcare model. There's a mix of private insurance, Medicare for elderly people, and Medicaid for low-income people. You have both for-profit and non-profit hospitals. Healthcare costs are much higher than in most countries, but the technology and facilities are often cutting edge. It's a market-driven system, which means competition affects everything from salaries to working conditions. Let me give you realistic salary numbers, but I need to give you state-by-state context because the US varies dramatically. In low cost of living states like Texas, Alabama, or Kansas, starting salaries for registered nurses ranges from $55,000 to $65,000 per year. That's $4,600 to $5,400 per month. In average states like Florida, North Carolina, or Arizona, you're looking at $65,000 to $75,000 per year, which is $5,400 to $6,250 per month. In high cost of living states like California or New York, starting salaries are $75,000 to $95,000 per year, which comes to $6,250 to $7,900 per month. After taxes, which are roughly 20 to 30% depending on the state, your take home is between $3,200 to $5,500 per month. With 3 to 5 years of experience, you're looking at $70,000 to $8,000 per year. If you specialize in intensive healthcare, emergency or operating room nursing, you could earn $85,000 to $110,000 per year. If you pursue advanced practice roles like nurse practitioner or certified registered nurse, which requires additional education, you could earn $100,000 to $1,800 or more per year. There are also additional earnings opportunities. Shift differentials give you 10 to 20% extra for working nights or weekend. Overtime is paid at time and a half. Signing bonuses of $10,000 to $25,000 are common in areas with nursing shortages. Now, before you get too excited about these numbers, let me give you a reality check. Health insurance costs you $200 to $500 per month, even with employer coverage. You're responsible for your own retirement savings through something called a 401k. There's no mandatory paid vacation by federal law, and the cost of living is much higher in the high-paying states. A $90,000 salary in California might give you less purchasing power than $65,000 in Texas because rent, food, and transportation cost so much more. Work conditions in the US are quite different from Germany. The standard working week is 36 to 40 hours and 12-hour shifts are very common. You might work 3 shifts per week, 12 hours each. Overtime is available and often expected, especially during staffing shortages. The work environment is less regulated than Germany, which means it varies significantly by the hospital. Vacation time has no federal minimum requirement. On average, you start with 10 to 15 days. This increases with tenure, or so after 5 to 10 years, you might have 15 to 25 days. You also get 6 to 8 federal holidays. That's roughly 3 to 5 weeks total annually, which is less than Germany, but still reasonable. 12-hour shifts are physically and mentally demanding. You might work 7 a.m. to 7 p.m. or 7 p.m. to 7 a.m. The flexibility varies by facility. Some hospitals let you choose your schedule, others assign it. Let me break down the requirements step by step because the US process is different from Germany. First, you need educational qualifications. You need a bachelor's degree in nursing or a 3-year diploma from a recognized institution. Your education must meet US standards, and there's an evaluation process called credentials evaluation. Second, you need to pass the NCLEX RN exam. This is the National Council Licensure Examination for Registered Nurses. It's a computerized adaptive test covering medical, surgical, nursing, pediatrics, maternal health, mental health, and pharmacology. The difficulty adjusts based on your answers, so everyone gets a different test. The pass rate for international nurses is around 60 to 70% on the first attempt. Third, you need English proficiency. Most states accept IELTS with a minimum score of 6.5 to 7. If you're already fluent in English, this won't be difficult at all. Fourth, you need state licensing. Each US state has its own nursing board. You apply to a specific state, they verify your credentials, and once you pass the NCLEX, they issue your license. This process takes 3 to 6 months. Some states have additional requirements like the jurisprudence exams about nursing laws. Finally, you need visa sponsorship from an employer. This is employer dependent, meaning a hospital or healthcare facility must be willing to sponsor you. The most common visas are H-1B or EB-3. The EB-3 visa often comes with a direct pathway to a green card, which is permanent residency. Work permit helps significantly, while not always mandatory. Having 2 to 3 years of experience makes you much more attractive to employers. The immigration pathway in the US is complex but rewarding. Initially, you will likely enter on a H-1B visa or EB-3 immigrant visa. The duration varies, but EB-3 leads directly to green card processing. The green card gives you permanent residency, meaning you can live and work in the US indefinitely. Your spouse can work and your children can attend school. Processing time vary widely from 1 to 5 years depending on your country of origin and visa category. After 5 years of permanent residency, you can apply for US citizenship. You will need to pass a civics test about American history and government. The US allows dual citizenship, so you can keep your origin passport. Let me talk about lifestyle because this is where the US is incredibly diverse. Cost of living varies enormously by state and city. In low cost of living areas like Texas or Tennessee, rent for a 1-bedroom apartment might be $600 to $900. Groceries are $200 to $300. In high cost of living areas like San Francisco or New York City, rent alone could be $2,000 to €3,500. Groceries, transport, and other costs are proportionally higher. Your total expenses could easily be $3,500 to $5,000 per month. Let me be honest about the pros and cons. The pros are significant. Salaries are the highest in the world for nursing. Career advancement opportunities are massive. You can specialize, move into leadership, even start your own practice. The meritocracy is real if you're good and ambitious. You can rise quickly. Technology and facilities are cutting edge. You get geographic diversity with 50 states to choose from. The green card pathway is clear, and there's a large diaspora for community support. But the cons are real too. Healthcare is expensive even with insurance. Work-life balance is worse than in Germany. Some hospitals are understaffed and overwhelming. Job security varies. You can be laid off more easily than in Germany. The political climate is polarized and can feel unstable. Gun violence is a real concern, though it varies by area. Social safety nets are weaker in Germany. If you lose your job, there is less support. So what's your next move? Your nursing license isn't just a certificate, it's a passport to opportunity most people only dream about. It's a key that can unlock doors in countries around the world. The question isn't whether you're capable. You absolutely are. The question is whether you're willing to step through that door. I'm not here to pressure you into anything. Here's what I recommend. Take a week to think about this. Don't make a decision right now. Talk to your family, write down your priorities. Maybe even reach out to nurses who are already working in Germany or the US. Ask them questions, get real perspective. If you're finally ready, get your documents ready. Make sure you have your nursing degree certificate, licenses or registration, work experience letters and your passports on hand. Then send us a DM on WhatsApp at 09086722775. I'll repeat that again, 09086722775. If this video helped you understand nursing opportunities in Germany and the US better, I would appreciate if you like this video. It helps more nurses find this information. Subscribe to our channel because we regularly post detailed guides about healthcare careers abroad, not just nursing, but also caregiving, physiotherapy, and other medical professions. Drop a comment below and tell me, German or US, which one appeals to you more and why? I read every comment and often make videos based on your questions. If you want personalized guidance, go to fures.com and book a free consultation with our team. We'll discuss your specific situation, answer your questions, and help you create a realistic plan. You can also send us a DM on WhatsApp at 09086722775. Thank you so much for watching. I hope it gave you clarity. See you in the next video. Bye.